hit record. So we will be recording this webinar. It will be shared out publicly after today, after we get a few days to get it up on Homebase's website. But yeah, I want to just kick off with introducing myself. So Riley Me from Homebase, and I'm going to be leading us through some introductions and context setting for this webinar. And this is a joint webinar from Homebase and the Western Center on Law and Poverty. And so, as most of you likely know who are on this call, Medi-Cal Inter-County Transfers, that's a process that Medi-Cal members must go through if they move to a new county. And so we're so happy to be here with you today to just dive deeper into that inter-county transfer process and share how they're supposed to work. And we also have a lot of time today to answer your questions or hear your comments about the rules and processes for inter-county transfers. And I'm going to go to the next slide to just share some reminders about and some tips for our webinar. So we are recording this meeting. All webinar materials are going to be shared and posted on Homebase's website within the next few days. So the materials are going to include our new guides on intercounty transfers that I'm going to talk more about in a bit. And it'll also include the meeting recording. So the guides are already up on the website. We'll share in a bit. And we also just want to remind you all this is a Zoom webinar. So you can see the speakers, but we cannot see you. So you are all muted and you can use the Q&A function though. That's going to be on the bottom tab of your Zoom screen to ask us questions and provide comment. We're going to have a dedicated Q&A section at the end of the webinar. So we're here for an hour and a half. We're hoping to have maybe more than 30 minutes for Q&A. So definitely you can save your questions for the end, but if you do have clarification questions throughout, you can pop them in the Q&A feature and we will be tracking those questions and make sure we answer them as soon as we can. But yeah, we definitely love questions. So definitely if something comes up, you're curious about something, definitely this is the time to ask us and we can work through those questions together. And also at when we get to the Q&A portion, we can unmute you if needed. So you'll be able to raise your hand and we'll be able to unmute you if it's easier for you to share a question or provide comment just by speaking. All right. So we want to provide some context on the organizations that are presenting this webinar. And we're going to provide some context on the new guide that we've created. So um, presenting today is Homebase and the Western Center on Law and Poverty. And so I'll start by introducing Homebase. We are a mission-driven nonprofit based in the Bay Area, but we work nationally to build community capacity to end and address homelessness. And so our mission is focused on homelessness, but over the past 10 years, we have been building expertise at this intersection between healthcare, housing, and homelessness. So happy to be here sharing information that is helpful to a wide range audience, not just homeless service providers and addressing intercounty transfers. And so I'm here today from Homebase with also my colleagues, Julie and Carla. Feel free to come off mute if you want to introduce yourself or add anything else about Homebase.
Hi, everyone. Julie Silas.
All right. So next we have Western Center represented on this call today. So Western Center is a California-based nonprofit made up of attorneys and legal advocates who fight in our courts, cities, counties, and at the state capitol to ensure a strong safety net for Californians with low incomes and do a lot of work related to healthcare. So David, David Kane is representing Western Center today, and do you want to come off mute, introduce yourself?
Thanks, Riley. Hi, everybody. I'm David. So glad you're here.
Thank you. All righty. So here is our agenda for today. So I'll be wrapping up the introductions and welcome in just a bit. I'm just going to provide a little bit more context of what led us to this moment, and I can share more information about our new guide on intercounty transfers accompanying this webinar. Then the bulk of the meeting, David and Julie are going to lead us through a great overview of what is in our Medi-Cal Inter-County Transfer guides. And so this is meant to be an overview. It's pretty broad, but really comprehensive. And you'll familiarize yourself with the transfer process, but we highly, highly encourage you to take some time after this meeting to read the guides later on. And we will leave, as I mentioned before, some time for Q&A at the end. And so definitely can save your questions till then or pop them in the Q&A feature throughout. All right. So I've hinted several times that Homebase and Western Center have jointly developed a new guide, Moving with Medi-Cal. It's on Homebase's website already, and I'll put it in the chat again. Oh, Julie beat me to it. Thank you, Julie. Yeah, so take a look at that. It's at the top of this web page Homebase has that has other information related to Medi-Cal, specifically Medi-Cal renewals. But our materials, there's a full guide. And so that full guide takes you step by step through the Medi-Cal Inter-County Transfer process. Again, that's a process required for any Medi-Cal member that's moving to a new county. And the guide also shows you how to troubleshoot common challenges that may come up and shows you how to address frequently asked questions. So it's meant to demystify the transfer process. And in order to just kind of streamline this information, we also created two roadmaps. So these are both two-page documents that just summarize the key steps for one, initiating an inter-county transfer by reporting your move, and then the second one, selecting a new health plan. And these are really great resources if you just need a broad, brief understanding about intercounty transfers. And then if you have a specific challenge come up, that's when you would be a great resource to go to the full guide to get more comprehensive information. So excited to be able to share these with you. And if anything I just said you maybe weren't familiar with, didn't make sense, we're going to go over all of that today. So you're going to get that kind of roadmap overview through this webinar today. And then I just want to do some shout outs before we move on. First, we want to give a big thank you to the California Healthcare Foundation. They help make these guides possible through funding, helping spread the word, and just providing support and seeing value in this work. So thank you all at the at CHCF. And then also we want to shout out all those who participate in Homebase's monthly Medi-Cal renewal office hours. So this is a meeting space predominantly of homeless service providers and some health navigators. We all started meeting monthly originally to talk about the challenges and successes for people experiencing homelessness, navigating Medi-Cal renewals when the redetermination process picked up again after a 3-year break during the COVID pandemic. But as we were meeting monthly, naturally, other topics of conversation related to Medi-Cal enrollment and processes came up, and we kept hearing providers' experiences and questions about intercounty transfers and hearing specifically about the unique challenges people experiencing homelessness who are Medi-Cal members face more often in the intercounty transfer process. So the issues and challenges raised there helped Homebase kind of uncover some systemic questions and issues with transfers and need for more clarity specifically. And so we're just really thankful for everyone who raised those issues to us, and we were able to partner with Western Center, who has a lot more expertise in how transfers do and should work. But yeah, just big shout out to those who made this guide possible and provided a lot of helpful insight and input. But you will now get to hear some other voices talking. I really appreciate you kind of listening in on our introduction and background about why we're here. But I'm going to pass it over to Julie now. She's going to explain what exactly is a Medi-Cal intercounty transfer.
Thanks, Riley. Yeah, so Riley spoke a little bit about that when you're moving from one county to another county in California, you have to change your address, update your address, and request an intercounty transfer. And it's a little different than a lot of other Medicaid programs in other parts of the country. So even though California's Medi-Cal program is a statewide program, it's administered separately by each of the 58 counties in California. And because many people, most people in Medi-Cal are enrolled in managed care, there are different managed care plans depending on which of the 58 counties you're in. Some managed care plans serve many counties, some managed care plans may only serve one county. And so because so many people are in managed care plans and there are 58 different counties, when a member moves from one county to another, they literally still have Medi-Cal, but they may not be in the right managed care plan that serves their specific county for their specific population. And so there's a need to request an intercounty transfer so that the access to the health care that you have, the insurance that you have, works in the new county where you land. And one thing that we really want to point out is that you don't need to reapply. People don't need to reapply for Medi-Cal when they move from one county to another unless it's during their renewal period. But if they're moving 3 months after in the first 3 months of their new year of coverage, it's really an intercounty transfer that needs to happen when they're moving from one county to another. And a lot of people don't understand that. And so they'll reapply, and they don't need to reapply for insurance that they already have. They just need to make sure it's distributed to the new county where they land. And just overall, people need to be aware that unlike some private insurance, can take up to 2 months. And we've heard from some of our community that if it doesn't go smoothly, it could take a lot longer than that. But if it goes smoothly, it's usually about a 2-month process. Next slide, Riley. So, well, as Riley said, we've been working, and Western Center has been working for many years around making sure that people have strong processes in place to do intercounty transfers. And some of the challenges we've heard over the last year and a half is that people don't always know where and when to request an intercounty transfer. We, working with so many homeless service providers, they're used to interacting primarily with Medi-Cal through their managed care plans, the managed care plans that either are they contract with to provide Medi-Cal services. And so what happens is they think they're updating the address when they tell the Medi-Cal managed care plan, but that's an updated address. It's not an intercounty transfer. Medi-Cal managed care plans don't have any power over that. And so that's been something that's really confusing to people. Another thing that we hear a lot is that people get stuck in the transfer process. Sometimes it's communication issues between counties. Sometimes it's not telling the right entity about the intercounty transfer. There's a lot of reasons for it, but that means how do you get unstuck if that transfer hasn't gone through? So we're going to talk a little bit about that today. And then also complications there are complications with a transfer, it can really impact members' access to really important health care that they have. And we'll talk throughout about there's certain situations where there are benefits that can only be received through Medi-Cal managed care. And so that can complicate things, especially for people experiencing homelessness. And unlike people who are housed, people experiencing homelessness may more frequently be moving across counties. And so I think what we've experienced here at Home Base is that the population that we work with and the providers we work with are experiencing challenges with intercounty transfers in a way that other advocates might not always, or with more frequency. So that's part of why we partnered together with Western Center to bring this information to the forefront and help people ground with what the processes should really look like. So I'm going to pass it over to David, and he's going to jump in on all what we need to know.
Thanks, Julie. So Medi-Cal Inter-County Transfers, we thought a lot about how do we present this in a way that makes sense? Well, it turns out there are two distinct parts of it. We're going to go through each in order. The first is reporting your move to a new county. That'll be the slides that have the red at the top. And then the second is enrolling in a new Medi-Cal health plan. That'll be the slides with the yellow orangey color. at the top. So we'll start with reporting your move. When you are moving and you have Medi-Cal, generally you want to do this 10 days, no later than 10 days after you move. That is a requirement under the Medi-Cal program to report that change to the county. It also is a good amount of lead time to get the process going in time. How you do this depends on whether you received your Medi-Cal through having supplemental security income, also known as SSI, or whether you have your Medi-Cal directly from the county and the state. Some people don't know whether they have SSI, so we'll talk about that shortly, but the processes are different depending if whether you're in the SSI group or you're in the group of everybody else who does not have SSI. And as Julie mentioned earlier, we really want to highlight that you do not start this process by telling your Medi-Cal health plan. You have to tell somebody else, either the county or Social Security. If you tell your Medi-Cal health plan as your first step, it's only going to delay the inter-county transfer process. So for SSI recipients, people who are receiving supplemental security income, the first thing you want to figure out is, does this person get SSI? And you can do that by contacting Social Security. We've heard from advocates that the best way to reach them nowadays is by visiting a local Social Security office near where the person lives. You can also call Social Security at this phone number here to confirm whether somebody receives SSI. If you get a yes answer, they receive SSI, then you know this is a process you have to follow, because when somebody has SSI, they get their Medi-Cal through SSI. If they are moving, they report their address change to their Social Security office, the same ways by visiting in person, which we hear is the best way to do it, or by calling Social Security and updating the address by phone. When this happens, Social Security sends the address update over to the Medi-Cal program at the state, and that will then begin the processing of the inter-county transfer for this person. Sometimes you don't learn if Social Security has updated the address. There's really no way that they tell you, and you might be waiting to see, is my inter-county transfer going forward? If this is happening to you, you can call Social Security and ask them to see, did they actually input your new address in the system? If they said yes, and you're still waiting for your transfer to be processed, you can contact your local county where you are moving to and ask for them to speak to what's called a MEDS coordinator. A MEDS coordinator is a person in any county who has access to the computer system where they can go in and see if the Social Security new address has reached Medi-Cal. So Julie, let's see how this works with Martha.
Yes, let's talk about Marta. So Marta is on Social Security supplemental income. And Riley, I need you to switch the slide so I can remember her situation. I didn't want to get her counties wrong. So she's moved to Fresno County. She used to live in LA County. And when she went to a Fresno County physician for a checkup, she was told that her Medi-Cal eligibility still showed she was in LA County. And so the physician did not have the ability to provide her services. Because she has SSI, she immediately went in person to local Fresno Social Security office and initiated an inter-county transfer. And then she waited for a bit. And she called her doctor's office, the one she originally went to about 2 weeks into it, and she tried to reschedule her appointment. And when they looked online, they found that her Medi-Cal transfer to Fresno County still hadn't been completed. So luckily for her, it was just a wellness visit. So it didn't prevent her from getting her care that she needed. That was good. But she did find out, well, okay, it's still not happening, and I really would like to get this doctor appointment. So she went ahead and called the Fresno Medi-Cal office, and she asked for the meds coordinator at the Fresno Medi-Cal office to make sure that her Medi-Cal eligibility was actually changed to Fresno County. And she was successfully able to do that. And when that went into effect, she was then able to schedule her wellness visit and be able to see the doctor in Fresno County.
Thank goodness. So that's how it works for people who have SSI, which, by the way, are the minority of people in our state who have Medi-Cal. The vast majority of people with Medi-Cal get their Medi-Cal not through SSI, they get it directly through the county and the state Medi-Cal program. So for everybody else, this slide is for you. If you are getting your Medi-Cal this way, you report your new address to the old county, the county you are leaving, or the new county that you're moving to. If there's just one thing that you remember from this webinar and from our entire multi-page guide and resource sheets, please have it be this fact. You can report your move to either county, the one you're leaving or the one you're moving to. If either county says, no, not me, go to the other county, they're wrong. The law says either county has to begin processing your inter-county transfer. There's no wrong door. So how do you reach the counties? You can do so by visiting them in person, calling them, mailing, or going to either of these websites listed on this slide, Benefits Cal or Cover California, to submit your address change and your move, your notice of your move. There are specific timelines that apply to counties and when they are processing the inter-county transfers on the next slide. The counties have about 7 working days to begin processing the inter-county transfer. If you are reporting your move to the county that you're currently in, that you are leaving, this means they have 7 business days to get your case to the new county. If you are reporting your move to your new county that you don't live in yet, or that you just arrived to, this means that county has 7 days to ask the old county to send your case to them. So that's how the 7-day timeline works. Then we wish we could say that there is a strict timeline by which the counties must finish the inter-county transfer, but there sort of isn't. Wish we could say it's 30 days, but actually it could take about 2 months. And that's because the real deadline for completing an inter-county transfer is you count from the day that you first tell the county 30 calendar days, and then you go to the first day of the next month. So for example, if you reported your move on April 15th, you would count 30 days to get May 15th, and then you would go to the first day of the next month, which is June 1st. That would be the deadline for processing the inter-county transfer reported to either county. And that is a right. That is the timeline. If it takes any longer, you'll want to speak up to get it processed on time. So Julie, how would this work for Jesse in Ventura County?
Yeah, I'm going to hold on that for a second because we have a couple comments in the chat that I want to just address. As David has said, you can tell your old county or your new county. And we have heard things that you all are saying in the chat that sometimes the counties pass it back and forth and say, that's not our responsibility. You have to do it in your old county, or that's not a responsibility. You have to do it in your new county. And when you're in those situations, you'll see, I think we have a slide about the Ombuds office, but there are places you can call and there are materials. We talk about this in our materials. You can call the Health Consumer Alliance, you can call the Medi-Cal Ombuds office, but counties are supposed to process your inter-county transfer, whether they're from the county where you started in or where the county that you newly arrived in. The other thing is really important is something that was asked also. Can a Medi-Cal recipient call the Alameda Alliance? Alameda Alliance is an example of a Medi-Cal health plan, as we've said a few times, the Medi-Cal health plans are not responsible for intercounty transfers. You might want to tell them you have an updated address, but they're not going to initiate an intercounty transfer. So that is what often delays by calling the health plan instead of calling either SSI, the Social Security office, or the local Medi-Cal office. So it's really important to remember there are two state federal agencies that can initiate intercounty transfers. SSI, Social Security, or local Medi-Cal office, not a health plan. They will not be able to do that and it will delay. Okay, so Dave was talking
So,
about the time. Go ahead,
yeah,
David.
yeah, Julie, thanks for that. And thanks for reminding me to look at the chat. I also noticed something else I really want to lift up. I'm so glad we have people here from counties and representing counties. We got an important clarification, which is if you want to contact a meds coordinator at a county, this is especially if you have SSI linked Medi-Cal and you contacted Social Security to report your address, but it's not getting to the county or you don't think it's working because you're waiting too long. Earlier, we said you have to get somebody to talk to a meds coordinator. Big important clarification here, thank you, is that you don't necessarily have to reach the meds coordinator. You can ask anybody at the county Medi-Cal office to look up whether your address has been updated in meds, which is the database that holds the addresses for people with Medi-Cal.
Thanks, David. So we're going to talk a little bit about Jesse. So Jesse, and this is going to go through the time frame that David talked about, but specific to Jesse. So in early November, on November 2nd, Jesse was getting ready to move to Kern County from Ventura County, and he told Ventura County that he was going to be moving to Kern County and that he was going to move about 4 weeks later. So Ventura County had 7 business days until November 14th, because we're talking about business days, to start the transfer process and send his case to Kern County from Ventura County. Then Kern County has 30 days until December 14th, plus all the way till the first day of the next month to complete the transfer. So for example, because the 30 days was December 14th, the actual transfer should go into effect on January 1st, the first day of the following month. And so that's what happened to him. And when he arrived on January 1st and he was in Kern County, his Medi-Cal case showed that he was now registered for Medi-Cal in Kern County. Qualifier is that's a long time. If he moved on December 6th, well, he didn't have access to his Ventura County providers. So if he needs the transfer to be processed faster, he can request an expedited transfer from the Medi-Cal office, the county Medi-Cal office. And David will be talking about that in a little bit, what it means to ask for an expedited transfer when there's a medical need. But that gives you an idea of how the process should work. Back to you, David.
Thanks. Yeah, expedited transfers. Let's talk about it now. So you can't wait 30 days plus till the first of the following month. This often happens because this is healthcare we're talking about. Well, you can request what's called an expedited inter-county transfer. This is available to people that have immediate medical needs. An immediate medical need can be any medical care that you need immediately. So if it's you got an appointment coming up, you have a dialysis treatment, you have a prescription to pick up, you have a treatment scheduled, anything that you need immediately for your health care. What you can do is you tell the county that you reported your inter-county transfer request and your move to, that you want it processed expedited, faster. You tell the county about the person's medical condition and their need for care immediately. When the care is needed, sometime earlier than about 2 months, and why the member or the person needs the care when they need it. With that information, then the county has the information it needs to begin working on an expedited transfer. Sometimes this doesn't happen though, which is on the next slide. And then sometimes it takes longer than 2 months for an intercounty transfer to process. When this happens, the processes are slightly different about how you follow up, depending on whether the person has SSI, Medi-Cal, or they have Medi-Cal through the county or the state. For SSI-linked Medi-Cal people, they can follow up at this state email inbox. It's the non-Magi inbox. That's 2 I's in there. It's easy to miss, but you can click on it in our guide and in these slides once it goes out. You email the state to ask what's going on with the intercounty transfer. You provide the identifying information for the person with Medi-Cal, and they can look into whether it has gone through or whether there's some type of hold up. For everybody else, the vast majority of people, you can email this inbox, medicalnow@dhcs.ca.gov. You can include the same type of information, and the state can look into what's going on and work with the county to get it processed. Sometimes, though, this doesn't work, and you might be working with somebody that wants to assert their legal rights to have this done on time. When that happens, reach out to the Health Consumer Alliance. The Health Consumer Alliance provides free, confidential help to people statewide on these types of issues. You can call as a person who is helping somebody with Medi-Cal and talk to somebody, or the person themselves can call the Health Consumer Alliance, or you can call them together and find a way to get the intercounty transfer moving. So that was everything in reporting the move. We might want to pause there. What do you think, Julie?
Yeah, I want to pause because there's a couple things that are coming up. So there was a clarification point that it's not anyone necessarily in the local medical office that can make changes and look about the meds, someone's status in meds. Not every staff person has access to meds, but it has to be someone who has access to meds. So it's more than the meds coordinator, but it might not be every single staff person. Another question that folks had, David, that I would love for you to answer is the expedited transfer. Does that also work in Social Security with the Social Security Administration? Or once the intercounty transfer is initiated, it all goes through Medi-Cal?
Good question. For people with SSI, when you report your move to SSI and they put the new address in their system, overnight, that should be sent to the state database, meds. Sometimes it doesn't, but it should. Then it becomes the state and county's responsibility to manage the Medi-Cal. And so the request for anything expedited would still go to the county to handle and look into what needs to be done.
I think those were the ones that were specific to what you had spoken about. I think we're okay to switch, and then we can take some of the rest of the questions at the Q&A.
Okay, great. That was a lot, we know, on just one, reporting the move. So now we'll get into step 2, which is enrolling in a new health plan. So one way to think about this is while you are waiting for your intercounty transfer to be processed, that is one period of time. Then there is the entire period of time after your intercounty transfer is processed. And we'll talk about those separately. So the first, when you are waiting for your intercounty transfer to be processed, you have 2 options. You can keep your current Medi-Cal managed care plan, or you can disenroll from your current Medi-Cal managed care plan. And then once you have completed your intercounty transfer, you would enroll in a new health plan in your new county, which could be the same plan as your old county. It could have the same name if there are plans in both counties, but it all depends on which county you're moving between, because there are different plans in different counties. And we'll talk about both of these steps now. So while you're waiting for your intercounty transfer to be processed, Your first option on the next slide is to keep your current Medi-Cal health plan. To do this, you can contact the county office where you reported your Medi-Cal move and tell them that you would like to keep your current Medi-Cal managed care plan. And this normally works for people who are able to still access care in their former county. Normally it's for people who are moving just across county lines or have a way to get back to their old county. And it works for them because they want to keep seeing those doctors in the month or two while they're waiting for their inter-county transfer to be processed. So this is something, if you want it, you do have to speak up and say to the county, I want to keep my current health plan, because there are some technical things that go on behind the scenes while inter-county transfers are being processed that could result in somebody being automatically booted or kicked out of their Medi-Cal health plan. So if you want to stay in your plan, make sure you tell the county as soon as you can. So Julie, how does this apply to Henry?
Good question, David. So Henry is living in an emergency shelter in Stanislaus County. And while he's there, his Medi-Cal health plan approved him for some of the new housing-related community supports, specifically housing navigation. So he's getting help, looking for a house, getting his documents ready so that when he is eligible, he meets all the criteria that the landlord would ask for so that he can get a smooth transition with a local housing provider. And while he's working in Stanislaus County, getting those services, he gets a job offer in Yolo County and decides to move there and live with a friend, taking this opportunity to come out of the emergency shelter and be able to start moving towards stability. He initiated the inter-county transfer. And while he was in that waiting period, he decided to stay on his current health plan before the transfer was processed. So he asked to stay in Stanislaus County and stay receiving his community supports, the housing navigation. And so he was able to still do virtual calls with his housing navigator in Stanislaus. He was getting the support he needed. They were helping him with his documentation while he was starting his new job. And he was able to continue that in Stanislaus while he was waiting for the transfer to be processed. The important thing to know is that it was his only option for keeping those community supports, because community supports are only available through Medi-Cal health plans. And so if he had chosen to leave his Medi-Cal health plan and go for fee-for-service Medi-Cal during the waiting period, he would not have access to that community support, that housing navigation. So for him, it was really essential that during the waiting period, if he wanted to continue to get help with housing navigation, that he stay in his original Medi-Cal health plan. If he had opted to withdraw and disenroll, he would have had health insurance, he would have been able to get prescriptions, he would have been able to go to the doctor, all in regular Medi-Cal or fee-for-service, where Medi-Cal providers who aren't necessarily associated with health plans are licensed to provide Medi-Cal, and you find someone that can do that for you. But that is not the case for the housing related support. So his only option, and he made a really good choice, to stay, continue his enrollment in Stanislaus during the waiting period. David, anything to add there? Nope. Okay, back to you.
Thanks. Yeah, so we're still in this period of you're waiting for your inter-county transfer to process. What are your options if you don't stay in your current Medi-Cal managed care plan? Your other option is to disenroll from your plan. You can ask to do that immediately, which might be needed if you're in your new county and your managed care plan that you had in your old county doesn't operate in your new county. You would want to disenroll from your plan. This helps people who can access Medi-Cal through what's called the fee-for-service system. It is available, and many Medi-Cal providers contract directly with Medi-Cal through the fee-for-service system, so you would access your care that way, not through a Medi-Cal managed care plan. You can request this disenrollment by contacting the county where you reported your move to, and they have an online form where they can go in there and make sure that you are request that you are disenrolled from your Medi-Cal managed care plan, or you yourself can call the Medi-Cal managed care ombudsman and ask to be disenrolled immediately while your inter-county transfer is being processed. It can be hard when you are on fee-for-service Medi-Cal. Just a warning. That's because nowadays, most people access their Medi-Cal through a Medi-Cal managed care plan, and so fewer and fewer providers are actually contracted with fee-for-service Medi-Cal. Also, there is no one place for you to call for help finding a Medi-Cal provider. You would have to locate providers in your community that accept fee-for-service Medi-Cal. It is possible. Many people do it. Many people like it. It just takes a little bit of extra work.
I want to just chime in because I'm seeing a lot of questions. We can't keep up with all your questions now, which is why we have Q&A, but there's a few things I just want to call out. So a lot of you are asking about the slides, and I think you want the slides because of the details that we provide about where to call and the names of the emails and the names of the roles. That is all in the guide that is on our website. So there's nothing in these slides that you can't find in the guide, and many of the things that you can even find in the quick reference sheets. So we have a reference sheet on how to initiate an inter-county transfer, and then we have another reference sheet for these options about what to do to enroll in a new plan during transfer period and then permanently. And all this information that we're talking about, we pulled right from those fact sheets. So you can have those by your side on your desk, and you'll have all the contact information, including a link how to find fee-for-service Medi-Cal providers. So we've tried to provide you as much information so that you're not having to take good notes here, so that you can be able to use these materials in your day-to-day practice to help yourself and your clients. Okay, I think we're at another example, right?
Yeah.
Yeah, so
Go
this
for
is
it.
Laura. So Laura receives SSI, so she's getting her Medi-Cal along with her SSI, and she reported her address change. She lived in LA County, moved to Orange County, and she went to her Orange County Social Security office to let them know that she had an address change and to inform Medi-Cal that she was initiating an inter-county transfer. She couldn't return to LA County. She didn't have transportation, even though Orange County is adjacent to LA County. But for her situation, she saw an endocrinologist, and she could not go back to LA County to get services through her current endocrinologist. So during her transfer period, she opted to disenroll from her Medi-Cal health plan in LA County so that she had access to fee-for-service providers. She called the Medi-Cal managed care ombudsman and explained that she needed to see an endocrinologist regularly during the transfer waiting period. So theoretically, that was an expedited transfer. She might not even use the language. She might not have known to use that language, but she basically communicated to Medi-Cal ombudsman that she needed access. So they disenrolled her from her enrolled plan, her old plan, within 2 days. And when she got to Orange County, she had to do two things. She needed medications, and she needed access to a regular endocrinologist. When she went to the pharmacy to get her medications, she still showed up in LA County, but the pharmacy still, even though it was based in Orange County, had to provide her medications, regardless of the fact that in the system she still looked like she was in LA County. And that's a special rule for pharmacy dispensation. When she contacted the meds coordinator in Orange County, they assured her that her system showed up that she was in Orange County now. And so she was able to enroll in a new Medi-Cal health plan in Orange County right away. So she was able to get the process done in a shorter amount of time than what is a regular traditional process. David, anything to add? Okay, back to you.
Thanks. Okay, we're finally through the period of waiting for your inter-county transfer to process and your two options during that time: stay in your plan or go to fee-for-service Medi-Cal. Now, we'll talk about what you do once your inter-county transfer has processed and you're in your new county. You have to select a new health plan to enroll in. For most people, this means you will be mailed a choice packet, is what it's called. It arrives from Healthcare Options. It has in it a bunch of information about what plans are available in your new county, and you can choose which one you want to enroll in. If you don't choose one, the letter you get in the mail will set a deadline for you to turn in your preference. And if you don't send in your preference by that deadline, they will pick one for you. So it's important, if you want to have a say in what plan you're in, watch out for this mailing you get that gives you the option to enroll in a plan. This is how it works in most counties, but it's also different in every county because each county has its own managed care plans and different models for those types of plans. So in some counties, they have only one Medi-Cal managed care plan. These are called county organized health systems, or COES counties. In those counties, you are simply enrolled in the one plan because that's the only one. And that happens automatically. And so you don't have to submit a choice packet or a choice form in that situation. Something that comes up here is, well, what if you don't have access to your mail, which could be especially likely when you're moving, and also may be likely all the time if you don't have access to mail. So if you know you don't have access to mail to receive this important choice packet, you can call Healthcare Options by phone and ask them, is it time? Can you pick your new plan? And they will tell you whether you can or not. The other thing you can do is you can go online to Healthcare Options, and they have a website. The link is in our guide, and you can try to do it there, and it will let you do it when it's ready. And so it's something you would just have to follow up on if you don't have access to mail to make sure that you can pick your plan as soon as your inter-county transfer is processed. Healthcare Options will let you do it. So the next slide has a sample of the choice form that would be included in this packet that is mailed. This is roughly what it would look like. You can return this to Healthcare Options by mail. You can also call Healthcare Options and simply tell them, or you can do it by creating an account on the Healthcare Options website and doing it that way. So let's see how this works for Regina.
Thanks, David. So Regina is in San Mateo County, or was originally in San Mateo County, and she worked with a diabetes specialist there. And after she started seeing and had established a relationship with her specialist, she got into San Jose City College and she moved to Santa Clara so she could be closer to her campus. But she also, for folks who aren't familiar with Northern California geography, San Mateo County abuts Santa Clara County, so they're not too far away from each other. She requested an inter-county transfer, and 2 months later, she picked her new health plan in Santa Clara County, but she didn't want to lose her diabetes specialist, but that diabetes specialist was out of network now. So she wasn't stuck. She actually had the opportunity, and Medi-Cal rules allow this opportunity. She asked her new health plan if she could have continuity of care so she could continue seeing her out-of-network specialist who was in her San Mateo health plan, but not in her Santa Clara health plan. She was in active treatment. And the out-of-network provider, her diabetes specialist in San Mateo, was willing to contract with Santa Clara County's health plan, and follow the rules and requirements of Santa Clara County's health plan so that they could continue serving Regina. And so she was able to get authorization from the Santa Clara County health plan, to continue her services with her diabetes specialist who she was seeing when she left San Mateo County. So that's just an example of some of the things that have the ability for the state to recognize people's unique healthcare needs and have some flexibilities to be able to meet their needs without harming someone who is in the middle of treatment or who needs continuity of care even when they make a change across health plans and counties. Back to you, David.
Thank you. We're almost done. Still getting into your healthcare plan that you want after your intercounty transfer has processed. It can sometimes take a bit of time for that to happen. In almost everybody's situation, they will have about a month of fee-for-service Medi-Cal, unless they request some sort of expedited processing. Here's how you do that to request an expedited enrollment in into a Medi-Cal managed care plan. You can contact the Medi-Cal County office, and they have a way where they can use an online form to request an immediate or faster enrollment in a Medi-Cal managed care plan. You can also call the Medi-Cal Managed Care Ombudsman again, and they can work on getting your Medi-Cal health plan enrollment processed sooner. So those are options that you will want to pursue if you want to be enrolled in your plan sooner and try to avoid 1 month of fee-for-service Medi-Cal eligibility. They're also good to keep in mind if your intercounty transfer is taking longer than it should. You will want to follow up as soon as you can to make sure that you can get into the health plan in your new county to be accessing care. So what happens if your health plan enrollment is delayed? Well, that's what you do. You call the Medi-Cal Managed Care Ombudsman at that phone number. They can tell you about whether you've been disenrolled from your old plan, when that happened. They can work with you to enroll in a new Medi-Cal health plan in your new county and tell you all the details about your options and when it will be effective. And that is the right office to contact to troubleshoot that. Oftentimes, though, people run into some trouble. So if that happens and they don't get what they want or the timeline is not working for them, they can again reach out to the Health Consumer Alliance for free confidential help to try to overcome any barriers to enrolling in a Medi-Cal managed care plan on time. Was it, in a nutshell, simplified. All the details are in our multi-page guide and 2 attachments.
I am going to break our rules a little bit, David, and I'm going to actually walk people through the guide just so that we've had a lot of questions about what information is available. So I thought it would be worthwhile to show you what is on our website so you can see all the great information that you will have accessible. You can share with your colleagues. But basically, we have a guide. This is the long guide, and it has basic information about Medi-Cal Inter-County transfers. It talks specifically from the experience for people experiencing homelessness. And then we walk through the sections that we talked about today. What do you do to initiate a transfer for SSI? What do you do if you're getting your Medi-Cal not through SSI, basically everyone else? How to expedite a transfer, how to change Medi-Cal plans during the transfer, and then how to access your healthcare coverage ongoing in the new county. And what I want to kind of show you also is these frequently asked questions. So a lot of the things that you've been asking in the chat are in here. So I just want to quickly scroll through this so that you can see it's a wealth of information. It's a great resource. It's very in depth. We call out specific notes of things to consider that might be unique. You'll see the phone numbers. You'll see literally clickable to the list of local Social Security offices. So you can click on that link to find where your local Social Security office is in the county that you work in. Also, where you can do a walk-in and addresses and faxes for the local offices. So you'll see a lot of this stuff. A lot of the stories that we told are in a little bit more in depth also across each of these areas. And then any big issues of concern or important details that we want to call out and have you know, we call out and we all have these this important symbol comes with those. And you'll see this throughout the whole document. You see many important things here when you're talking about doing inter-county transfer through SSI. Similarly, non-SSI, we have the same contact information. We have the links to Benefits Cal. We have the links to finding out addresses and phone numbers for Medi-Cal offices. So just kind of quickly scrolling through stories, steps, even some diagrams to show you how the time frame works. And then this becomes the section on when you need an expedited transfer and you need it faster. So I just wanted to show you that this is all very step by step and very similar to what we just walked you through with a lot more detail. And I'm going to scroll through really quickly to show you that we've had, as Riley said in the beginning, we have these Medi-Cal office hours. We've gotten a lot of hard questions in those Medi-Cal office hours. We had people who are daily working with people experiencing homelessness and other Medi-Cal members who have reviewed this and fleshed out for us what are some of the key questions or FAQs that would be helpful to answer. So we have pages of FAQs. What do we do instead of applying? What happens if someone wants to do an inter-county transfer instead of applying new for Medi-Cal in a new county? What are the deadlines? Why should someone experiencing homelessness, what should someone experiencing homelessness do if they don't have a new address in the county they're moving to? So we have a series of FAQs, and you'll see it's many, many pages because there are a lot of complications and things that people want to know about. So, and then we have an appendices. I'm going to quickly show you, that's deep, right? And that's, as David and I and Riley have sometimes grumbled about, it's a lot of information, 21 pages. That's a lot to take in. So to help you out and have a cheat sheet, we made one cheat sheet for reporting a move and one cheat sheet that is about enrolling in a new plan and enrolling in a plan during transfer. And these are really simple. And they're 2 pages and they have the key information, the contact information, all the kind of key information so that you get used to the process and you just want to have this handy dandy 2-pager sitting on your desk or in a drawer that you can pull out, maybe putting it on your corkboard to remind you who you should call, where you should call, and how you should call, and what the standards are. So we have one again for part 1, initiating the inter-county transfer and making sure it goes forward. And then we have one for part 2, enrolling in a new health plan. And this section is about the transfer during the transfer time. And then we also have the section about going forward. So I just wanted to reassure folks, we'll also have the webinar posted on the Homebase website, but just know these are written to make it easier for you. The dictionary, 21-page dictionary is there, and then the 2 cheat sheets are there. So we'd love feedback if there's details in the cheat sheets that you expected that are missing. Let us know about those, but we hope that these are really helpful to you. So I'll turn it over to Riley.
Yeah, thank you. Thank you so much, David and Julie, for walking through the guide. I hope that was helpful for everyone. We're seeing some really great questions coming in, and we're going to answer those who haven't been addressed yet. But first, we actually have a question for the group. So we want to make sure that the guide and materials Julie was just sharing are accessible. So we have some questions about whether you all think it would be valuable translating these materials into other languages, and if so, what languages. So we're going to launch a Zoom poll right now and would really appreciate your participation over the next minute or so. And then once we get in your answers, we are going to go right back into Q&A, and we've got 30 minutes left on this call. So hoping we can get through a lot and learn together. All right, so I have launched the poll, so it should come up on your Zoom screen. There's two questions. Would you like to see these intercounty transfer materials translated? And if so, into what languages? And I will close the poll in a minute. I see you all are answering really quickly. Sometimes it takes a while to get polls answered. So
You can see how much, what percentage, Riley?
yeah.
Okay.
So far, I know not everyone has filled it out yet, but um, most participants have, and we see 90% saying yes, we should translate these Medi-Cal Inter-County Transfer materials. We should translate them, and then there's a lot of 94% say to translate into Spanish, and but there's a lot of representation for the other languages we provided. So this is really helpful insights for our team as we might look to expand who these resources are accessible to, because um, as you know, this transfer process applies to any Medi-Cal member, and they all come from different backgrounds. So I will end the poll now. We've gotten most people have completed it, and definitely seeing a lot of favorability for translating these materials. So I'll share those results really quickly so the group can see. And now I am going to pass it back to, or pass it off to Carla for the first time, who's been tracking all your great questions, and we're going to try to answer them the best we can.
Thanks, Riley. Yeah, so we've been tracking your questions, tried to answer a lot of them that we could, but we're going to go over some of the ones that we didn't get to. So the first question that we have, there's actually two questions kind of related to this. Is there a physical address needed if a person's unhoused? And I think this person is referring to specifically when requesting the transfer. This was Andrea, but if you meant at any other point, because I know Julie addressed when the person is like choosing their health plan, their new health plan, what to do if they don't have an address. But I think here Andrea is referring specifically to somebody who is maybe like moved counties but doesn't have a physical address.
Yeah.
Yeah.
You do need a physical address, but it doesn't have to be a house. So you can use your shelter and use their address. You can find somebody else in the neighborhood, or a family or member or friend. And if you do not still have an address, you can ask the county to have them use their address for your physical address. David, can you just clarify anything that I might have gotten wrong or details?
Yeah, that was right. And I would just direct people to our FAQ and our guide number 4 as all of the details on what you should do. One nuance is if you have SSI, of course, it's different. So SSI and Social Security, we looked it up and asked around. They apparently they don't need an exact address. They have a way to update SSI cases, if you can provide other information about the area that you are moving to, that might and is likely to work at Social Security.
And I see another question here about reporting a change in address online. So just as a follow-up there, as David said, I think earlier, if you're in non-SSI Medi-Cal, you can use Benefits Cal or Covered California online. But Social Security, as David said, not only is it recommended to go to the local Social Security office, but actually even in person is the most effective. So not only not online, but even not on the phone, the most effective is going in person.
Thanks. And then just to clarify, kind of going along those lines of like the difference between SSI, Medi-Cal, and non-SSI, we know that for non-SSI folks, they can report the address change to either the county they're moving to or the original county. Is that also the case for the SSI folks as well?
I'm not sure. Um, that's something we would have to research and get back to you on. I would say contact the Social Security office by phone or go in person. If they don't take your address, update. If you have SSI, ask them for instructions on how you should submit it.
Thanks for that. If a person is has Medicaid open in another state, is it the same process? And we had two questions on that.
No, it is not the same process. Can answer that pretty clearly. And this guide does not cover interstate moves. That is a completely different process, not covered by this guide.
Thanks. We had a question about keeping CalAIM benefits during or after an inter-county transfer. So Julie had gone over that and how, for example, community supports and other CalAIM benefits, you can't keep those under, you can't continue receiving those under fee-for-service. But do you want to sort of reiterate that point of how do you keep your CalAIM benefits and how that might influence your choice of whether to keep your old plan or enroll in the new plan?
Yeah. Just to restate, the way that the new CalAIM benefits for housing related services, the enhanced care management and the housing related services and even non-housing related services, medically tailored meals or sober living centers, those all are only available through a Medi-Cal health plan or sometimes called Medi-Cal managed care plan. And so people will lose access to those if they go into fee-for-service Medi-Cal during the transfer period. So there's a couple things you can think about. You could ask for an expedited transfer, right? So if it's literally physically impossible to keep your housing related services from your old health plan in your new county and that they won't do it, the provider doesn't cover that area or they don't have access to virtual meetings, it's a Medi-Cal benefit. And so if you want housing navigation services, you should argue that you need an expedited transfer because that's a Medi-Cal covered service. And so that would be one idea that I would suggest if for some reason you can't stay in your old Medi-Cal plan and you need to get into a new one right away, then expedite it and use hey, I'm in the middle of services for housing navigation and I need continuity of that. Wow. And I can't lose that for the next 2 months. But I don't know if that would be effective. That would be something that we would be curious to hear if anyone tries that, how it goes. Okay, Carla.
So another question was, do any changes happen during the month after asking for transfer request rather than just the first? And if so, which changes are those?
I can oh, go ahead, David.
So if I'm understanding the question, it is you request your inter-county transfer in March, like this month. We want to know what's going on in April.
If they want to find out if they have to wait all the way to May 1st, is there anything that could happen before May 1st?
Oh, yeah. So yeah, the normal timeline would be to wait until May 1st if you do not have an immediate medical need. If you can't request an expedited transfer, that would be the normal timeline. But if you need your inter-county transfer process sooner, then you request an expedited inter-county transfer. If you don't, the normal process is, yeah, April would likely be your month of fee-for-service original regular Medi-Cal enrollment. And then during the month of April, you would be able to select a new Medi-Cal managed care plan in your new county. Sometimes, because this all happens in a very technical way behind the scenes, it might actually be April and May when you're in fee-for-service Medi-Cal. And so it would be June 1st that you're enrolled in the Medi-Cal managed care plan, even though the inter-county transfer completed on May 1st. That may or may not have answered the question, sorry, or could have been too much information. I don't know. Julie, anything to add or clarify?
No, I see a question here in the Q&A section about why does it take so long? Why does it have to be so complex? And that is a really good question. And we've raised that question, and advocates have been raising that question for a while, because when I'm switching my insurance and private insurance, it doesn't take 2 months to get that accomplished. And it's not even going from one type of coverage to another, healthcare coverage. It's just literally a transfer of where you get your coverage, but the health insurance is continuous. So in my mind, it should go faster. And we've raised that issue. Like this is not a streamlined process, and that we would encourage try and figure out a more streamlined process. You can hear, though, as we speak, you have an SSI office you need to go to, then the Medi-Cal office is dealing with it, then you have an ombudsman, then you have healthcare options. So it's a very fragmented system with a lot of different parties. So it makes, I'm not saying it's correct, but it makes sense why there's so many levels of bureaucracy and communications that are being dependent on. But I would say we would agree with you that for people who are who have coverage, who have a right to coverage, and their coverage didn't disappear, but it's literally just a change of address, that it shouldn't take as long as it does. But that's the current situation that they have.
Yeah, I would say keep in mind if it's taking too long, consider the expedited options we discussed today and that are in our guide. Also consider your options for accessing care, whether you want to be in or out of your current managed care plan, or you want to be in the new managed care plan faster, or if you want to be in fee-for-service Medi-Cal because that works for you. There's just so many ways to navigate this, to access care. I would consider them all and check out our guide for the options.
Thanks, David and Julie. Two comments that folks made in the chat that I wanted to lift up. Someone said that an ICT is not required for SSI recipients, that once the address is updated, the SSI is changed to the new county. And then someone else said that they were told by county office that San Francisco County office has 60 days to process the transfer. So just wanted to lift those up.
Thanks, and I saw that. Thank you, Dee Dee, for that clarification on that process. And then if a county is saying that it's taking them 60 days to process it, they could be doing our same rough estimate of about 2 months. But as we described earlier, it is 30 days plus until the first of the following month. That is the deadline in the law. That is everybody's right to have their inter-county transfer processed by that time. So that is actually the deadline. It isn't always 60 days.
And just to say, you can call the ombuds office if you're on the 59th day or the 61st day and, shake the tree a little bit. But also we have on both in the guide and in both reference sheet, fact sheets, if you're really stuck, the Health Consumer Alliance can sometimes shake the tree for you. So if you're not having success working with the county, call the Health Consumer Alliance and they can hopefully help expedite that process.
Yeah, just since we're talking about the Health Consumer Alliance, what is the Health Consumer Alliance? I think it's good to know. It's not necessarily someone you're going to reach on the phone who's going to just do the thing right away. The Health Consumer Alliance is a network of 10 legal services agencies that cover all 58 counties in California. You call them, and if you're a professional helping somebody, you should be able to speak to somebody about the situation you're trying to help somebody with. If it is the person with Medi-Cal calling, the Health Consumer Alliance will most likely open up a case for that person to be able to do some advocacy to try to get their inter-county transfer processed. So you may not get it fixed in one call to the Health Consumer Alliance, but they could do some work to get it done soon.
Thanks for that, David. We had a few questions about fee for service. Anthony mentioned that they're seeing healthcare providers turn away managed care members with fee for service because of ICT with the previous county code from the current county, and that this is often the biggest barrier for uninformed providers. So Anthony asked if there's any print materials that can be shared with those healthcare providers, but I guess I was wondering, yeah, how does that work? And like, is that happening with providers who do accept fee for service generally, but they're just rejecting it because it's a previous county code? What should be happening here?
I saw your question. It's a good one, and we've heard about this also forever. Our approach to this is it is an erroneous way to look at a person's Medi-Cal eligibility in the system. If they have fee-for-service Medi-Cal that is active and it is a fee-for-service provider, they may submit their claim and provide services. The county code in the Medi-Cal eligibility system for a member merely tells somebody what county is responsible for their Medi-Cal. And that is what the provider manual says. And that's all I've seen. If somebody knows of something else that instructs providers not to refuse services to people with erroneous, well, not erroneous, but I guess out of county codes in the system, please put it in the chat. We'd love to add it to our resources.
Thanks for that. Beatrice asked, can you clarify if while undergoing a transfer to the fee-for-service option, is that automatically approved if somebody requests it? And how quickly is this change reflected in meds?
Sorry, could you say that again? I was reading something real fast.
Yeah, it was asked if somebody decides to go with the fee for service option while they're undergoing the transfer. If that's requested, is that automatically approved? And then how quickly is this change reflected in meds?
Oh. Is it automatically approved? I'm not sure. You request it. It depends on how you are requesting it. If you are going through the county, they are submitting an online form to have somebody else do it in the system. If you are calling the Medi-Cal Managed Care Ombudsman, they can tell you on the phone right then and there whether they're going to do it, is normally how it works. And how quickly does it show up in the eligibility system? The ombudsman has 2 business days to make it effective. The county has 3 days to do the online form. And so it's sometime after those time periods is what the rules say. Does anybody have anything else to add?
We do have someone with their hand raised. I'm not sure if it's related to this question or another, but Carol, I'm gonna allow you to come off mute now. Feel free to unmute.
I'm muted.
We can hear you.
Okay, so when you call the managed care ombudsman, it takes 24 to 48 hours to be disenrolled from the plan. My experience is it's 24 hours. But the deal is, I work with foster children, but the question came up about straight Medi-Cal or fee-for-service. And are providers willing to see out-of-county adults or children that are straight Medi-Cal? It's very hard and very difficult when they see the fact that it's the resident code that's responsible for providing the service. So if you go to a provider for fee-for-service, it's difficult. we hardly can get foster youth seen when they're straight Medi-Cal in counties for a period of time. And it's getting harder because most doctors rather bill the managed care plan than the state because they have to send their staff for training. So it is a deal. Now, I did put in, if in fact you call the ombudsman and you're disenrolled in 24 hours, if the process takes 2 months for your address to be updated, you could be defaulted back into the managed care plan because you're required to be in a plan in that county. And so you may have to call the ombudsman again to be delinked. We have this problem with foster youth too.
That all sounds very familiar, Carol, and I love that you're using the ombuds office as much as you are, and so just encourage others to, like, that is what the ombuds office is there for, is to help troubleshoot and problem solve unusual situations, whether it's unusual for you and your client or it's unusual because the system isn't working how it should be. But don't forget also that if for some reason you can't reach the ombuds office or you're not getting the solution, to definitely
Right.
avail yourselves of the Health Consumer Alliance as well. Again, not as fast as David said, as oftentimes the ombuds office, but that is an option. And then also, as David said, in our materials, there are emails that are, I would call them kind of emergency. When you have an unusual situation, there are people on the other end of those emails who can troubleshoot problems as well. One of the things we recommend when you use those emails is that they're getting these completely out of context. They have staff, rotating staff who are in that position who may or may not have the expertise on the particular question you have. So being really clear in the subject, what you're writing about, and giving good context for the question you're asking, and not make any assumptions that that person has that background to understand, to be able to help you. And if they can't help you, at least they have the information to be able to identify someone of their colleagues who can respond. So there are a lot of different places you can do that, all within our materials, but just encourage you being as transparent and clear about what the problem is you're trying to solve in the context, and that can expedite the solutioning as well.
Thanks, Julie. One question that I don't think we've seen folks ask actually yet is if there are exceptions for when there's a survivor fleeing abuse and maybe they get emergency transferred, perhaps to another county. Yeah.
Thanks for asking this question. I was trying to look it up and I couldn't find the authority right away, but I would invite anybody in that situation to take advantage of and use their right to an expedited intercounty transfer if they have an immediate medical need of any kind, which could include any kind of medical care, any kind of mental health care, anything that Medi-Cal covers, where they need to access it. Somebody in a domestic violence survivor situation, I would say would likely qualify under that. The counties do have very careful and special ways that they manage Medi-Cal eligibility for survivors of domestic violence. So I would invite them to share now or later, and we can look into, investigate this, what rules would apply, and try to find an answer.
Thanks, David. Another question we received is if the county is slow processing the transfer and they miss the first of the next month, are you stuck waiting until the first of the following month for the transfer to be effective? Can there ever be a transfer that starts mid-month when the county misses the deadline?
I'm just going to weigh in and say it's a reasonable thing to require and to advocate for. If there's obligations in the state that they have to fulfill these particular deadlines and they miss the deadlines, then I think you should require, or at least ask for the remedy, is to not to have to wait an extra month for failure to meet the state requirements for 60 days or 2 months or whatever. We say 60 days, but the 7 days, the 30 days, and the first of the month. If they miss that first of the month, it's a reasonable remedy to ask them to start you mid-month. David, you might have more of a legal answer to that.
The challenge is often in the Medi-Cal health plan enrollment. So yeah, there can be mid-month Medi-Cal eligibility changes in the county database, but you still might have to wait to the first of the month for a managed care plan enrollment or disenrollment to take effect. And that's most often where we see people having to wait until the first of the month for something to show up.
And for folks who have benefits that can only be accessed in a health plan, anyone who has that concern that they might not be able to go that whole more than the allotted time, really encouraged to find the situation and argue for an expedited transfer so that you don't go longer than necessary without access to those services.
Thanks so much. We also had a question about during the inter-county transfer process, once the new receiving county accepts the transfer, must they continue with the same Medi-Cal coverage/eligibility aid code until annual reassessment or reported change in income, or can they choose to reevaluate without a reported change by the beneficiary and change coverage? Beatrice has seen a person transfer to a new county, and the new county sent an NOA changing Medi-Cal from 0 SOC to an SOC amount.
Great question. An inter-county transfer alone is not a reason to do a Medi-Cal renewal, except in certain situations, if somebody is entering a new household, leaving a household, and the household size changes, or the person who's moving, their circumstances change, like they got a new job, or they have a new person that they're in their household who also has income. So sometimes going through an inter-county transfer can result in there being a Medi-Cal renewal done, but it is not required. And for most people, it likely wouldn't happen if it's a simple inter-county transfer. We have the details on this in frequently asked question number 10 in our guide.
Carla, I know we don't have much time for questions, but there is one near the end that I want to make sure we answer because we usually address it. But people asked about when you're contacting Medi-Cal, the ombudsman, does someone need an authorized representative form to talk about one of their clients, or can they call and advocate on behalf of their beneficiary without them? And if you have the beneficiary with you, so if they're in person, or you can do a three-way call, and they give permission for the state to talk to you, that is sufficient. You don't need an authorized representative form. But if the client isn't with you and you don't have an authorized representation form, they won't talk to you about the specific case. Is that accurate, David?
Generally, yes. And again, different if you have SSI. It's a two-step process over at Social Security to be appointed as a representative on somebody's SSI account. Details on page 4 of our guide.
Great. I think I'll pass it back to Riley, since I think we got through most of the questions.
Yeah, thank you all so much for asking questions, and thank you, Julie and David, for doing a great job answering questions. On this next slide, we just summarize quickly everything we talked about today. Just remember, this is all in the guide, but largely inter-county transfers. There's 2 steps: reporting the move and then enrolling in a new health plan. But yeah, this brings us to the end of our webinar. Again, everything we shared here today, the recording is going to be posted and all the guides are already up on the Homebase website. So please review them, and also please share them. It seems like hopefully you all found this information really helpful and comprehensive. And if you felt that way, please share it. We want to get the word out about these resources. So, and if you have any questions that didn't get answered today, you can reach us at medical@homebasecc.org. Happy to hear from you. Even if it's just you tell us how this transfer guide helped you, we want to know. We want to hear your feedback. So please stay in touch. And we'll end the webinar now, but thank you all again for being here with us. Any last words, Julie and David?
I do have a last word just to let folks know. We said it in the chat, but the webinar will be available online. So if you found this valuable and you have colleagues and coworkers who weren't able to attend, really encourage them to go watch this online and access all the information. So thank you all for joining and for such great, robust questions.
Right. Bye, everyone. Thank you.
Thanks, Carlin, Riley, and David.
Back at you.